Hi.
Hi everyone. So I'm Purva and I'm UofT Scientista's Director of External Affairs, and this is Ananya. She's an incoming med student at University of Alberta, and I'm gonna ask her to introduce herself a little bit more.
Okay, hey guys. Purva said, my name is Ananya, and I'm starting at the University of Alberta Faculty of Medicine this fall. I did my undergraduate studies at
I can hear you now.
Hi, can you?
Yeah.
Okay, okay. Yeah, were you guys able to hear the introduction?
No, go again.
Okay. So my name is Ananya, and I'm starting at the University of Alberta Medical School this fall. And I did my undergraduate studies at University of Toronto. I did a double major in health and disease and psychology. And I'm happy to help and like answer any questions that you guys have today.
Okay, so our first question is, when did you first become interested in med school? Was there like a big moment where you knew you wanted to be a doctor, or was it like gradual throughout all of your studies?
Um, I think I think the first time I even started thinking about medicine would probably be because of Grey's Anatomy, like as cliche as that sounds. But that's what first caught my eye, and I started to think that medicine could be a potential career for me. But I really seriously started thinking about it in grade 11 or 12 when I did a bunch of shadowing experiences, and I really I spent a lot of time with physicians as they interacted with their patients, and I spent a lot of time volunteering in hospitals just to see whether, that was the field for me and whether it was something that I would be interested in. And that's how my interest really grew for the field.
What do you like most about the medical field? Is there
Um,
something that interests you most? Is there something you're most passionate about?
I think one of the things that I'd have to say is just the drive and the passion that that I've seen most physicians, medical students, and other healthcare professionals have for their field, for their patients, just, how committed they are. That's something that I've always really, really admired about the field, and just, the ability to make a really tangible difference in the lives of patients, and also just solving problems. That's something that I really like about the field. And yeah, I really also like that medicine has become a field where there's so much of collaboration between nurses, other healthcare professionals, psychologists, social workers. So that's also, I think, something that I really enjoy.
Um, Thank you. What traits would you recommend one possess that may indicate an interest or aptitude for the medical field?
So I don't think there's just, one absolute trait that there's no like cookie cutter perfect medical student or physician, because everyone is different, and everyone has their own strengths and weaknesses. But I think there are some things that I've noticed about most of the medical students or physicians that I've interacted with. And one of the things that I've noticed really is that they're extremely, extremely hardworking and dedicated to their field. So because medicine is a career in which you spend a long time studying, and even once you start working, you do spend a lot of time. The hours are really long, and so I think just that dedication and passion for what you do and being committed to what you want to do no matter what. So I think that is important. And also empathy. Just as a physician or as a medical student, you have to have a really strong sense of empathy for your patients because I think that drives everything that you do. Working with compassion and really understanding your patients and being there for them. There, I think I'd have to say there are a lot of other traits that I have noticed in physicians, but these are ones that are, really cultivated over time. So they include professionalism, expertise in your field. Those are traits that really can be cultivated over time. But if I had to say something that would be more innate, would be, passion and empathy.
What are some of the extracurriculars you did that you think helped shape who you are now and helped you get into med school and helped shape your interest for the field?
Um, I think so for I think every medical student, every pre-med student has their own journey and their own path. So I wouldn't say that there'd be just, a few extracurriculars that help me get prepared or I wouldn't say that every pre-med should go this way and should do these activities. But for me personally, what really helped me was volunteering first, because that really was my first experience spending a lot of time in a hospital environment and really seeing how the day-to-day functioning is and seeing interaction between physicians and their patients, nurses. So I think volunteering is something that really helped me decipher whether this is, the life that I want for myself. And then I think another thing that, someone's asking when did I start volunteering? I volunteered all through high school, but in Toronto, that was in Dubai, but I moved to Toronto for undergrad, and I started volunteering in first year at Women's College Hospital. And yeah, so coming back to your question, I think other extracurriculars would probably be research. I think a lot of pre-meds are involved with different kinds of research because medicine really has become a lot about, innovation and really, you know, finding new solutions to the problems that people face and the healthcare, you know, yeah, I think, sorry, and yeah, I think so. Volunteering and research were both. Is there? Okay, so Jesse is asking, is there any kind of volunteering that's particularly good for med school application? Um, so I think what I'd really have to say when it comes to volunteering is that it should really be something that you're interested in. So there wouldn't be one kind that's particularly good. It really has to be the kind of volunteering or like what you want to do because you are volunteering your time to someone else and without really, you're not really expecting anything in return. So it should be something that you're really passionate about and something that gives you a sense of fulfillment or a sense of purpose. So if it's volunteering in an old age home or at a critical care center or at Princess Margaret. Um, okay, so I think that answers your question. And then someone else is asking if I'm an Ontario resident or Albertan. Um, so I'm actually an Ontario resident, so thank you. Um, yeah, so I applied to Calgary and Alberta medical schools as well as schools in Ontario.
You mentioned volunteering, working in a hospital, being in a hospital environment with other doctors and seeing their passion, but that's really great. But was there one moment where you looked at what the doctors were going through, just emotionally and mentally, on a personal basis, and did you think maybe this isn't for me, or if I do choose this field, there's so much that I'm going to have to work through and be prepared to face. I need to be really mentally strong.
Um, yeah, so I think one particular case, when I was in the summer of my second year, I was working at Mount Sinai Hospital. I was actually working on I was a research student there, but it was a more of clinical research role. So I had to do rounds on patients and really interact with patients a lot because we had to interview them for our study. And really, so in that role, I did actually interact with a lot of terminal patients. And I think one case in particular was this guy who was about my age, a couple of years older than me, and he had a terminal cancer, and he was just really frustrated with his situation. And you could just see the confusion and like how scared he was. And just I think so that particular case was really hard for me because I did have to go and do my rounds and really interact with him, and then really gather like information based on like the symptoms he was facing for the study. But he was so frustrated, understandably. He was just really, really he was so scared because he was alone, and there was no one, like none of his, I don't think any of his family members were there. And so I think that case, like that day when I went home, I was I literally like called my mom and I was crying because I think it was something that really hit me, and it really made me realize that this is something that physicians will have to deal with on a daily basis in this field, loss and really and not always being able to learn that I oh, hey.
Okay, can you
So
hear us
we're
now?
yeah.
Sorry, I think the Wi-Fi must have cut off. Okay, I can hear
Can
you
you hear
now.
me? Can you guys hear me? Apurva, you're kind of
Yeah,
like
okay, I think.
freezing. Um,
Okay, is it okay now? Is it okay now? Sorry.
yeah,
Um, so you spoke about research and working in a hospital in your second year, and that's really impressive because it is really hard to get research positions. Can you talk a little bit about how you got your application, what the how you got your position, what the application process was like, the interview, and just the whole experience of working in a lab and working around doctors? Yeah.
absolutely. Sorry, before that, I just wanted to check if you guys were able to hear my answer to the previous question because I think it got a little cut out there. Um, okay. Tanya, do you know if you guys were able to hear me for the previous question? Uh, I was just asking if you were able to hear. Okay, so do you want me to go back to the previous question, the one about the healthcare field and some of the difficulties? You're freezing. Apurva, you're freezing. Like I'm not able to
Cut off.
hear you. I'm just gonna just join again.
Sorry, I think she's just gonna come back. Just give us 1 second.
Okay. Can you guys hear me now?
Yeah.
Okay, great. So I'm just going to repeat the previous question. So I think what I was really trying to get at was that something that through my shadowing and my volunteering, that I saw that physicians would have to really deal with on a day-to-day basis would be, losing patients and really accepting that they're not always able to help them, no matter how much they want to. Sometimes it's not enough, and accepting that you did the best that you can. Okay, so I tried to move to a different spot. I hope it's better now. Okay, so I think we can move on to the next question
So
about, you
the
were
next,
asking about the
I
application
can,
process?
yeah, I can just repeat the question. So
Yeah.
you mentioned that you got a research position in your second year, which is really impressive because it is really hard to get research positions. So can you talk a little bit about the application process, how you contacted the researchers, and then a little bit about like what you wrote to them, the interview process, and then also what it was like working with a doctor and around scientists on a daily basis?
Okay, and just to clarify, you meant the interview for the research position,
Mhm.
right?
Yeah.
Okay. So I think so when I did send in applications, I think the first thing to do was to start early. So I started way back in September, October, so the fall of the previous summer, like the school year. And so I started reaching out. I went on the different websites for the hospitals and the research institutes, and the different scientists and faculty that were taking part in different kinds of research. And I kind of shortlisted the fields that interested me and the ones that I would like to hopefully work in. And then there would be like an email address, a little like introduction to the physician's research or the scientist's research, and then yeah, so that's how I short made my list of who I wanted to contact. And then I drafted like a general email, like just format to follow, where I introduced myself. I said a little bit about myself, my what I was studying, which university I was in, and a little bit about my research background and how and why I was interested. And then for each scientist that I applied to, I customized it to their research. So I spoke a little bit about their research, why it interested me, maybe ask them a couple of questions to show them that I really was interested in their work. And then I attached my resume, and I also attached my transcript in case they wanted to see my GPA or the relevant courses that I took. And then it was actually pretty difficult because I emailed over 100 people, and I didn't get a lot of responses initially. There were a lot of rejections, or sometimes because they're so busy, I didn't get responses. So, but then eventually, as I didn't, I just kept applying. And then eventually I did get a few interviews, and the first few interviews for me were a little bit difficult because it was the first time I was doing it. So they would ask me a little more about whether my past research experience, but like I said, I was only in second year, and so it wasn't I didn't really have that much expertise that could help, but eventually I think I did find one at Dr. Allison McGeer at Mount Sinai Hospital, who was who took me on, and I think that was a really great fit for me, and something that because she was interested in infectious diseases, and so am I. She was the director of infection control there, and yeah, so I interviewed with her, and then I started in the summer.
Okay, thank you.
So there's a question asking what my
We
GPA
can get to
was.
all of the questions at the end. So if you have any questions, just list them down, make sure that you remember them, and then we can have a question and answer session toward the end.
Okay.
Um, So that was so we've spoken about your extracurriculars um, and your research experience and everything. So we can talk a little bit about the application process for med school. What was your MCAT prep like? Did you do it more than once? Did you do any courses? Just how many months? What books did you use? Because there's so many courses out there. Yeah.
Okay, so I did the MCAT in the summer of my third year, and I initially planned to do it in the summer of my second year, but then I was working full time. And since it was the first time I was doing research, it ended up being, I didn't end up having that much time to study, and I decided to do it the next summer. And while I was studying for the MCAT in my third year, I was also working full time at the Krembil Institute I was working in a lab. Doing some wet lab research, but because of the first summer, I had that experience of really managing my time better. So this time around, I was able to really make a tight schedule for myself, and follow that and make sure that I was keeping up with the deadlines I had set for myself. I ended up I didn't use any prep courses. I studied by myself, but I used the Kaplan MCAT books, the most recent ones, because I found that those were really concise. Because there was a lot of content on the MCAT that I found that some of my previous courses had covered, and I didn't want to go as in depth. But if I did, and if I didn't understand something, I used Khan Academy. They have all their videos online available for free. So I used those because I had never done physics before. So I used those videos to really learn all the concepts that I wasn't that familiar with. And yeah, so I only did it the one time in my third year, summer. And yeah, was there anything else?
How did you prepare for the interview for
Medical
the
school?
MMI? And because you did this year, they mustn't have had the MMI. So what was different about that?
Okay, so first, before the MMI, there was the Casper test, which several of the medical schools that I applied to required. And for that, I had to, I read up a little bit about ethical scenarios and healthcare ethics. And then I continued doing the same thing for my interviews as well. So I read up this book called Doing Right, which is like an ethical guideline for medical trainees. And so I spent like a week or two reading that book and reading all the cases and the case histories, just because because my interview format was supposed to be a mixed MMI plus a panel. So I did prepare for the MMI scenarios that I was supposed to have. And I read up a lot about current affairs and current issues in healthcare and current research issues and current ethical issues. Just because a lot of the scenarios that are usually on the MMI are usually related to these, and I started doing that in advance, like at least a couple of months before my interview. I started with the current affairs and the ethical stuff before I even got an interview, just so that I have enough time to really go through all of them. And I really practiced speaking to myself a lot, like as crazy as it sounds. Like I would sometimes stand in front of a mirror or record myself speaking, just so that I could hear how I sounded and whether, practice a way of responding to interview questions. But as you mentioned, this year my interview was moved online. So 2 days before I was supposed to fly out, 2 days before my interview, I we got a notification that our interviews were moved online, and then the format was changed completely. So we didn't have the MMI, and it was just a very long panel. It was entirely a panel. But luckily, I think because I was preparing for both anyway. A lot of my preparation did cover a panel style interview as well. So that's how I did it. And then I had it on Zoom. And yeah.
Okay. Let's talk is really focused on women in STEM and pre-professional women in STEM. Let's talk a little bit about your personal experience as a woman. Throughout your study period so far, have you ever had to experience sexism or discrimination in your field? And have you noticed any with someone else?
Um, I think Personally, I've been very fortunate in that I haven't actively experienced any sort of discrimination just because I was a female. I think that at the level of education, it's kind of changing. There isn't there's actually representation of women is increasing, especially in medical schools, and a lot of medical schools now have more females than males. But so for me personally, even in undergraduate studies, there were a lot of women like in my courses, and a lot of my friends were. So I didn't really experience discrimination then. I did grow up in Dubai, the United Arab Emirates, which as a country, which I probably wouldn't, I would say is not as progressive as Canada in terms of women's rights. So over there, there were, I think, some things that through high school that where, I feel like boys were given more freedom and more opportunities than than girls in just because of gender or sex differences. But I think I have been very fortunate in undergrad that I really haven't faced um, actively just personally against me.
What would you say is the biggest challenge you faced as a woman in the medical field?
Um, I think something that women in medicine really have to face, and I think that's something that I've been thinking about a lot as well, is that because medicine is such a lengthy training process, um, they often talk about, will you have time for a family, and will you have time for having your own life, and like raising a family, looking after your family, and um, which is why I think that a lot of physicians and surgeons face a lot of discrimination as women, and why there's like less representation of women in those more niche specialties which require a lot of training. So I think something that I have like through family friends or through like relatives who they've brought up, like how are you going to have time for this, or like you know it's such a long process, you're going to be studying forever. So I think that's something that I would have to say, like that's something that did stress me out, and sometimes because people would keep asking me and I would have to think about, like, will I really have time to focus on everything that I want to, and what are and what really helped me there was figuring out what my priorities were and what I was interested in. And yeah.
Okay, thank you. I think that's it for the questions that I have. So I think we'll open it up from the viewers now. Does anyone have any questions? Just go ahead and type them and we can ask. Or if you have any comments or anything else you want to say.
I think someone asked me before about my
Your GPA.
GPA. Yeah, so could you just clarify, did you mean apply to a research position or to a medical school?
I think she wants to know about your GPA and your MCAT score. So I think in
Oh,
general, like when you apply to a med school.
okay. So my U of T GPA when I applied to medical school was 3.96, and my MCAT score was 518, which was my year 97th percentile. But different schools have different ways of weighing your GPA. So at University of Alberta, where I'm going, they remove your lowest year. And I think U of T does that as well if you did like a full course load every year. And for Ontario schools, they have a different way of um, like calculating your GPA. So I think when you apply to OMSAS, which is a joint Ontario medical portal, that one actually reduces your GPA slightly, and I think mine was maybe like 3.93. Yeah. Did I have any publications? So at the time that I applied, I did have one publication, and I had one that was in review, so it hadn't been published yet. If that answers your question.
Okay, I think we can just wait for a couple of minutes to see if anyone has any other questions. Okay, I think that's it. Well, thank you for joining and thank you for taking the time to speak with us.
Thank you for having me on your live. Yeah, so if anyone has any questions later on, they can just DM me on Instagram, and I'm happy to help out in any way that I can.
Thank you.
Thank you. Oh,
I think
okay.
Tanya has another question. Oh, Tanya has more questions. Does Tanya have any questions? Ashita is asking, was there any ethical question you particularly got stuck with during the interview?
Okay, so I think there was a lot of ethical dilemmas that I went through when I was reviewing and going through the books. But I think one of them was assisted dying, which has just become legal in Ontario and in Canada in general. So it's called medical assistance in dying, or MAID. And so I think some of the questions related to that were kind of challenging to really go ahead and answer, because there would often be the dilemma of what the physician thinks the patient needs, and to respect the patient's previous wishes, whether they had explicitly stated, whether they had an advance directive that explicitly stated what they wanted to be done in a situation like this, and then their surviving family members, or who, what they wanted to do and how they wanted to proceed. So I think those cases were a little bit tricky to maneuver. Yeah, so if that answers your question. And then Jesse is asking what advice I would give to people who don't have a really high GPA and what to do about medical school and want to go to medical school. So I think that yeah, medical school is definitely very competitive, and like the GPA requirements are often very high, but I think something to keep in mind is that it's only an average GPA that they put on their portals or on their websites, but there is a range, and often there's a very wide range, and you will find students with low GPAs and even higher GPAs than the average. So I would just tell them, to not give up and to keep trying, because medical school is something that it's okay if it takes you 2 or 3 attempts to apply and go in, because that is what majority of the students do. They do apply one time, and then if they don't get in, they do a master's in the meantime. They boost their GPA, they gain more experience, and then they apply again. So if medicine is something that you really want to do, it's something that you're really passionate about, don't let a relatively lower GPA bring you down or discourage you, and just to keep trying. I think that's the advice I would give them.
That's really good advice. Thank you. And Jesse also asked, can you talk a little bit about getting reference letters for med school?
Okay, so I think for reference letters, they changed it this year. So for Ontario and even for Alberta and Calgary, they didn't have reference letters. So those are the 6 medical schools that I applied to. None of them had a letter per se, but they had either a form with different questions, or asking like suitability for medicine, and then the referee would have to answer that and maybe talk a little bit about a particular experience. So it wasn't like a whole letter where they just talk about you. And so I think the advice that I would give in terms of getting those would be to make sure that the 3 people that you pick are people who can speak about different aspects of you and your personality and your motivation for medicine. So I think, like, for me, I picked someone who knew me in a volunteer capacity, then my research supervisor, and then a professor, so who knows your academic potential. So I think just picking someone who that covers like all the different aspects that they're looking for. And another thing would be to like make sure that they know you well, that you have had enough interactions with them that they can really speak about you and really answer the questions that are asked. And it's not a vague response, but they can give specific examples if they're asked. And also another thing would be to ask them in advance, because they are busy. And even no matter how much they would like to help you, sometimes they are really busy, and it would be helpful if you reach out to them and give them enough time to write out the references for you. So are there any more questions?
I think that's it. There's no other questions here. Okay, so
Okay,
thank you for watching and thank you for taking the time to
okay.
speak with us
Thank you.
today.
Thank you. Bye guys.
Bye.